Hey, Dr. C here again. Going to talk today about something that may depress the hell out of you, or it may start you thinking a little bit about dementia. Now, about 3 years ago, 4 years ago actually, and maybe 4 or 5 years ago, over at the Senior Center, I participated in trying to get Shrewsbury to be a dementia-friendly community. We had very productive meetings until I got tossed out of the Senior Center, and that ended everything. But what it did is it confirmed in my mind that our officials in Shrewsbury don't really give a crap about the seniors. But that's another issue. Today we're going to talk about dementia. Now, I'm going to emphasize the earlier stages of dementia because that's the one that is the most important, because that's the one, as soon as you can make that click, that diagnosis of dementia, that's when hopefully we can do something to help prolong life a little bit. There's no specific medication that cures dementia, and there are many, many different types of dementia. Roughly, if you look at the statistics and all, and we have great statistics on Alzheimer's disease, but that doesn't include all of the other forms of dementia. And as I mentioned, there's maybe a dozen other forms of dementia out there. But at any rate, specifically for Alzheimer's, 5.3 million presently in the United States. That's a fair number of people. And what if I told you that 500,000 people die as a result of Alzheimer's every year? That's equal to what is happening with COVID. 500,000 people a year. Not a big outcry about it. What are they doing about it? Obviously, there's some research being done, but what the research has accomplished basically is telling us a little more about what the different types of dementia are, what parts of the brain seem to be most involved. But in terms of treatment, not very much has been done. So, at any rate, let's talk about dementia. Basically, I always start with a definition. And so, what it is, definition-wise now, impaired intellectual function, interfering with activities of daily living, memory, performance, and communication. Now, that's pretty extensive. So let's break it down. First of all, intellect. Remember, impaired intellectual function. What is intellect? Well, that is the facility in our bodies for reasoning and understanding. Very simple. But there are components to that reasoning and understanding. Some of the components are, for example, memory. And memory has several different areas in the brain. There's parts that help us to understand, put it into recent memory and storage, and then that storage then gets transferred for the more remote memory, which is out in the cortex of the brain. The most recent memory is more in the hippocampal area of the brain, which is in the midbrain area in the hypothalamus, that region anyway. But the hippocampus is right near that hypothalamus. Okay, so that is intellect. That's intellect. And parts of intellect are memory, learning, and decision making based on the memory and what you've learned. In other words, your experience and your senses. All of that is part of your experience in the past. We're supposed to learn from that. Okay, so that is the intellectual function. Interfering with activities of daily living. What are the activities of daily living? Well, there are a couple. There are the regular activities of daily living, which basically eating, drinking, clothing yourself, being able to do some of the actual things, good hygiene. All these things are part of your activities of daily living. And we all may have some disability in one or more of those activities. Then there's instrumental activities of daily living. How are you doing with your checkbook, with your finances, and all that sort of thing? That's one of them. There are 5 different other instrumental activities of daily living, and they could be interfered with too as a result of the dementia process. Okay, one other definition before we can go into some of the specifics. Cognition. We always mention cognitive activities and cognitive depression, etc. So, what are the cognitive type of things? Well, cognitive refers to the brain processes, and that involves thinking. I think, therefore I am. I think. That's the thinking process. Then putting that thought into your memory. Judgment. Based on that memory and based on your experiences, you are now able to reason and make a judgment. Language is also included in that. And so the ability to learn is part of the cognitive activities. Now, as opposed to cognitive activities, which has to do with thinking, learning, and all, we have the conative. Those are the actual doing, the actual things that you do based on what your thoughts, etc. are. So that is the doing part. Some of the doing part may be genetic, innate, in other words, but the other is based on your experience and your mind activities. Now, examples of the innate type of activities, of the conative activities, gathering information. Where do you get it? Some people gain their information from reading. Some people are able to look at something and they can then express it in their mind. Some need to have to have it taught. They need somebody talking to them about it. That's the problem with what happened in COVID now. Kids, the scores have gone down dramatically in the last 2 years in the schools because remote is not even close to what you can get actually learning in the schools from a person to person. So some people are visual, some people have to hear, some people may actually have to read it. That's their thing. Some people, on the other hand, are kinesthetic. They have to do it in order to retain it. So those are the 4 types of learning activities that we have to do. And then we have to remember, we have to recall these things because we may have to do it again and again in the future. That's where the memory comes in. And the memory converts from recent to remote memory. And also, as part of that memory, we then have to use it as part of our judgment. We make decisions. So decision making is also part of that conative type of intellect. And then finally we have the affective. So you have cognitive, conative, and affective. Those deal, the affective ones deal with our feelings, our emotions, because that plays a role in decision making as well. It's very obvious, nowadays, the way it is in politics, a lot of affective decisions are made, sometimes spontaneously, but certainly that's the way things seem to be going politically right now. So we can have trouble in any of those areas or all of them. or all of them at once. The main thing that I want to focus on is early detection of dementia. So what are some of the things that we see on an early basis? Well, we may wind up talking to somebody and they just keep repeating the same question. Not necessarily one right after the other, but, gee, I just answered that 5 minutes ago. I just answered that 10 minutes ago. So repeating the same question because they don't recall that you actually answered that. Difficulty in planning. Now that is part of what they call executive function. Executive function. That is the ability to process all of those memories, all of the experiences, all of the sensations that you have had the experience of going through, remembering them, and then using them in making your judgments. So decision making is part of an executive function. Part of executive function. Managing your time. That's part of executive function as well. And so different parts of the brain are active during each one of these different phases of mental function. And we now have the ability to at least define where in the brain all of these things seem to be congregating. For example, the cortex, which is that outer layer, maybe half an inch thick at the best, that outer layer of the brain that you see. That has to do with storage of a lot of these different functions as well, and especially in reasoning and decision making. It also has something to do with social skills. That has mostly the frontal lobes, the ones in the front. Remember, you have 4 different lobes, one on each side: frontal, parietal, temporal, and occipital lobes. Now, the frontal lobes, they're the ones that control a lot of the social skills. So if you have a lobectomy, for example, and they cut off the frontal lobes from the rest of the brain, you may have a lot of difficulty then with your social skills. They don't do lobotomies as much anymore, and that's the removal of the frontal lobes. So, okay. But at any rate, that emphasizes the cortex. Now there are subcortical. In other words, the brain tissue under the cortex. There's a lot of connections that go on in that brain itself. And those connections are going on by the thousands all the time. All the time. Different areas of the brain seem to be concentrating on a specific type of function. For example, let's say the cerebellum in the back. That controls balance. So controls a lot of the balance type activities that your body may have. For example, in the brainstem, that's survival functions. Being able to breathe. You got to breathe. Your heart has to beat. So that's where it's all controlled. We may get it in our basal ganglia, which controls movement in the body. So different parts of the brain control specific areas. And they do it through transmitting, communicating with the next neuron up, with neurons in other areas, and they do it through these neurotransmitters that send their messages out all the time. Okay, we're going through now the early symptoms. So, difficulty planning, which is part of the executive function. Struggling with everyday tasks. Now, you've heard the term, well, he's getting senile. Okay, well, I've been called senile for many years now. And I'm only 82, going on 83. But is there a difference between being senile and dementia? Yes, there definitely is a difference in the two. It's when you struggle every day with these different tasks. That's a little too much. That's not just senile. That is progressing into now the phase of dementia as well. Where did I park? Now, it's not unusual almost every day when I come out of the store to see somebody wondering where the heck did I park the car. That's not unusual to see that. But when it happens every damn time you go, that definitely is wrong. Now, you can misplace your keys, but if you actually keep losing your damn keys to the car, that's wrong too. So in other words, there's a certain phase where you pass from what is normal to what is not normal. And so that's what I say. Where did I park? Also, how did I get here? Now, that's usually not till the later phases of dementia, where, why did I go down here? I came down to get something, and you go back up. Oh, cripe sakes, I forgot. And you go back down again. Okay, that part is still normal. Not often, but still normal. Now, if you totally forget why you went down, that's a different story. Why did I get here? People who have dementia tend to withdraw. They don't go out socially as they used to. They tend to withdraw. You have a great deal of difficulty multitasking. I remember when I was younger, I could do 4, 5, 6 different things, remember them, and try to do that in an organized fashion to do all those things. Now, sometimes I even have to write down my list for the day. Writing a list is okay, but when you have to rely on that day after day, that may pass that threshold again, may have crossed the line. Generally, people in earlier symptoms are very impatient. They don't like to wait. They don't do well at Disney World. They don't want to wait for an hour for something. They don't want to wait in the doctor's office for an hour. Well, I don't either, but probably nobody does. But they really do have problems with that. You have poor emotional control. That especially has to do with the frontal lobes as well. You may have to constantly use memory aids, like writing down your list every day so you don't forget anything. Oh, you're constantly losing things, constantly, every day, losing something. So those are all early symptoms and right on that threshold symptoms of dementia. I can recall back in 2014 seeing a film called Still Alice. And I truly remember Julianne Moore, who was Alice, who was a professor at, I believe, Harvard, and at a young age started having significant symptoms of dementia. This was in her late 40s, early 50s, young. Now, when you get dementia at a younger age, you tend to progress faster, and it tends to be worse. So I absolutely will never forget that movie. And if you haven't seen it, see it. It's really an eye-opener. There are a couple of books that you can read also about dementia. And they have all their own little language, you might say. And so get a book on it, especially if you're concerned about it either for yourself or a family member. Read it. It's important. Okay, let's talk about the specific dementia categories now. Obviously, Alzheimer's is the most common. In fact, 50 to 60% of all dementia out there are in that Alzheimer category. And the central problem with Alzheimer's is recent memory. That is the central problem. And so, roughly 2/3 of all of the Alzheimer patients out there are actually women. They're actually women. So that I don't know why. Nobody knows why. but that's a fact. Only about, fortunately, 5% are early onset, like Alice. Only 5%. When it is, it's very, very nerve-wrenching to see it. So, what defines Alzheimer's? Well, when I try to define it, I look at what is the pathology of Alzheimer's? Well, it used to be that they defined the Alzheimer's by autopsy. You had to die in order to get it cleaned up and looked at. Oh, you had Alzheimer's. Okay, fine, wonderful. But now we have different scans. We can define Alzheimer's with a CAT scan, for example. And what do they look for? They look for these amyloid deposits. Those amyloid deposits are protein that deposits at the end of a neuron where it transmits, where it communicates with the next one. That deposit is there, prevents communication. So they look for amyloid deposits, and they look for these tangles, little tangles of neurofilaments. Those two things, the tangles and the amyloid deposits, that defines anatomically Alzheimer's disease. Okay, so those are the things that we look for. And like I said, it occurs in certain areas of the brain. Like for Alzheimer's, it would be the hippocampal areas. You could get some in the temporal area because that participates in some of the early memory as well. And in the parietal area where there's some language problems that can occur as a result of Alzheimer's. Okay, so those are the things anatomically and all. And there are some tests that will help you to decide whether this is an Alzheimer's type dementia or not. And these tests, for example, the mini mental state exam. What it does with this mini mental exam, there's a list of about 12, 13 questions. And what they do is they make you go through those questions, and each question has a score from 0 to 5. Now, all of them have different maximal scores. For example, if you didn't know what year it was, what season it was, what date it was, okay, that's all going to score against you. So using that, they can define if you have dementia or not. Now, that's not the only exam that's out there, but it is one of the more commonly used testing scores. They can also do genetic testing, which at least would give you some idea if you have the amyloid protein problem, because they can analyze whether this is occurring or not. And they can do that either with a blood test or spinal fluid test. They can do that. They can also use other biomarkers. For example, they can now do a PET scan. PET scan will be very accurate about the amyloid deposits and the fibrofilament bundles that can occur in the brain. Okay, so that's the major form of Alzheimer's, and it comes in stages because it is a progressive disease. The early stage, we went through a lot of the different symptoms. Then you can go to the moderate stage after that. The moderate stage, you have trouble then with withdrawal, with finding things anymore, and a little bit more with each one of those things we mentioned in the early stage. Then you go to the severe stage, where now you begin to wander. You begin to be confused frequently. You can't remember names, maybe not even the name of your spouse. So that is a very significant, that's why it's in the severe category. And then finally, the very severe category of Alzheimer's. Now, there are other forms of dementia as well. Now, the dementia that I became very familiar with was a vascular dementia. These are in people who have uncontrolled hypertension. They get little areas of what they call infarcts, dead tissue within the brain due to the hypertension. And if it happens to hit certain areas, you're going to get dementia symptoms. So the vascular dementia, as opposed to Alzheimer's, which is 50 to 60% of the dementia patients, the vascular has been pretty well defined as about 17% of all of the dementia problems and all. One of the hallmarks of vascular dementia is inability to control your bladder and periods of inappropriate laughter or crying. All of a sudden, you're talking to the person, and all of a sudden they're laughing. No joke told. Inappropriate, very inappropriate. That's very characteristic of vascular dementia. And then we have Lewy body, L-E-W-Y, Lewy body dementia. That's about 10% of all of the dementias that are out there. And that's usually due to blood vessel blockage. And again, you get deposits of the protein, or maybe not just deposits, but bleeding, internal bleeding, microbleeding inside the brain. This is normally, besides the bladder control, you have very, very significant short-term memory loss with this as well. You may even get mobility problems. And this is why some people get misdiagnosed as a Parkinson's disease when they have Lewy body. Now, when they have Lewy body, you can usually get a scan. Usually it's an MRI scan, and they will pick up these deposits, these Lewy bodies that are congealed protein again in the brain. Now, the fourth part is the frontotemporal. That's, again, about 10% of the people who have that. That's usually characterized by impulsivity. Very quick to make your mind up at something, and it may not necessarily be correct. They also have trouble with executive functioning as well. Then you have number 5, a mixed type of dementia, usually a combination of Alzheimer's and vascular. Now, you may also get it as a result of excessive alcohol. You may get HIV-related dementia. You may get a chronic traumatic encephalopathy. You hear a lot about that because of the football players with multiple concussions in the past. Chronic traumatic encephalopathy, CTE, is that's called. We also may get, as part of another one, you may get a senior type of dementia over age 85, which very much looks like Alzheimer's, but it truly is not Alzheimer's. It's something that happens as a result of childhood. So I am running short on time, unfortunately. I didn't talk about treatment because there is no effective treatment. We can learn how to speak Alzheimer's. We can learn a lot of things about the different types of dementia, but giving them medication does not seem to improve things. It slows the progress maybe, and that's a maybe at best. Okay, we can do a lot more with this, but this is Dr. C, and have a good day.